Tony K. I was telling you that I felt special being in here and contributing in my way, like my dad did for so many years here. But first off, thank you for having me, and how you doing?
Doing great, thanks. I'm glad you're here doing this. So we appreciate you considering Pelham Medical Center for a spot.
That's right. For a long time now, I feel like I've known about Pelham Medical Center and the things y'all do here. And I'm excited to hopefully educate the Greenville community and people around the upstate more about Pelham Medical Center and Gibbs and all the incredible things y'all have. But I'm a little interested in you to start. I've never heard anybody pronounce your last name. So how do you properly pronounce your last name?
Kouskolekas.
Kouskolekas.
Just like it's spelled.
Where are you from?
Alabama.
Alabama. Where's your family from?
A lot of Kouskolekas in Alabama. No, not a lot of that. That's a Greek name. Both my parents grew up in Greece and decided to come to America to give their family a better life, which they did. And they came here in my dad got his master's and PhDs in the States and then went back to Greece for a time and then came for good in the late 60s.
Were they, was your dad a teacher?
He was a professor at Auburn University, and that's what got him to the States for good.
And what was life like for you? Do you have brothers and sisters growing up?
A brother, he's 8 years older, so, he's sort of evolved in my mind over time. He was sort of a hero to me, for so many years, and now he's, we're just both adults together. It's just hard to believe I have a brother in his 60s, and because you still feel young. But yeah, just the two of us and mom and dad, and had a great set of parents who taught us right from wrong, instilled a lot of hard work values and other things. And they both passed on, but it's just me and my brother now, and some family back in Greece.
Does your brother live in Alabama still?
He does. He lived in North Carolina for a long time, but had an opportunity to move back, and they actually live up in the northwestish part of the state, outside of Florence.
Got it. With you went to Auburn. Your dad taught at Auburn. Mm-hmm. Did he have to convince you to go to Auburn, or was that a choice you wanted to do?
No, he didn't really have to convince me, although I did apply to some other places. He let me know, though, that where I went and where the money went, might not be two different places if I didn't rethink it. But I really never wanted to go anywhere else, and I'm thankful that one of my kids went there, had the same great experience I did, and I wish that my father and mother had been alive while he was a student there. But so we got 3 generations of Auburn people.
The family tradition. I was guessing, looking at. Did you study engineering while in school?
I did. Pretty analytical, and when you're in high school, not many people really know what they want to do. I knew that I, wasn't going to go into medicine and didn't think I wanted to go into business. Most of the friends I had in high school, we were talking about mechanical engineering, aerospace engineering, kind of fascinating stuff. And started off as a mechanical engineering student, and the first class in the program is something called statics, which is just studying bridges and other things that don't move. Mm-hmm. And I made a C, and I said, boy, if this is the baseline course, I might want to rethink this. And found what's called industrial engineering, which is much more process oriented and statistics driven improvement. And just fell in love with the discipline primarily because not only it fit my analytical mind, but also you can really work in any industry. Mm-hmm. Historically, a lot of IEs work in manufacturing plants, other things, doing productivity studies, ergonomics. Knew that I probably didn't want to do that, and learned that healthcare was a place, and got on with a company that hired industrial engineers and put them in hospitals, and really pretty early on there fell in love with being in a hospital, and instead of doing that work for my career, most of the people I worked with at that time were hospital administrators. The work they did fascinated me, mm-hmm. and so that's what drove me to want to do that.
With because at one point, what got you to Charlotte?
Well, that company that hired me, Sun Health, they're now part of a larger organization called Premier. Was based in Charlotte, and placed industrial engineers all over the Southeast, North Carolina, South Carolina, Georgia, Florida. There were, probably 150 people, and it was a fascinating environment to learn in. I was fortunate enough to work with a lot of really smart people both my age and older, who taught me a lot. And what I really liked that a traditional, Masters of Healthcare Administration type program wouldn't have given me is I really learned the guts of the hospital from A to Z. I learned how everything worked at a detailed level much more than I ever would. So I think it prepared me. It took me longer to sort of advance in the way that a traditional hospital administration student might grow and advance, but I wouldn't trade it because of what I was able to learn. It's hard when you're leading people who, particularly clinical people, you don't do that work as a non-clinician. It helps a lot to understand what they really do, and that time of 7 years really prepared me, I think, for that.
Yeah. You might not know this, but you share UNC Charlotte with my mom. Also went to
Is
UNC
that right?
Charlotte.
Okay.
She
Well,
sure
I knew
did.
your dad was a big South Carolina guy. I knew they were both from Charlotte, but I
Yeah.
didn't know that she went to UNCC. Yeah, much different school now.
It sure is. It's grown a lot.
Than when she went. Yeah, and even when I was there, but now, I mean, it's a destination school. It was a commuter school when I first moved to Charlotte. Not anymore.
Yeah,
Not anymore.
without a doubt. With your career path, did you have an idea at that point, what kind of administration you wanted to get in, or what was your focus?
Yeah, again, I think to some extent, we're Pelham Medical Center is what you call an acute care hospital. So people that come and stay for an acute episode, a short period of time, versus say a long-term care facility or a nursing home or that kind of thing. And that was the kind of work that the Sun Health and then Premier was primarily with the acute care hospitals. So I knew I liked that environment. The challenge is any organization and any industry you're in's got a natural career path to it. And because mine was not natural, I had to think about ways I might have an opportunity to do some things. And so really my hope was just to get on board eventually with a healthcare system that saw value in the experience I might have, and then determine if I could be a leader in an organization like that. And I did. I had an opportunity with Atrium Healthcare, which was Carolina's healthcare system in Charlotte at the time.
It's a big one,
and huge, and moved into a part of the organization that did very similar work, a lot of planning, operational improvement kind of work, and with that, got to work all across the entire enterprise and had an incredible amount of exposure into large projects as well as mentors who eventually put me in a spot to land at one of the hospitals as an operational leader there as a vice president, and then I guess the rest, they say, is history. And I've worked there for 14 years, 7 at a hospital actually out near UNC Charlotte, Carolina's Medical Center University, which I think has changed names a couple of times now, and then have been here for almost 12 years.
Do one of those mentors stand out?
I really can look back on having great mentors at each stage.
And maybe not even professional, also personal.
Yeah, again, I've been very blessed. Elizabeth Rhines was the very first boss I had at Sun Health, and she was a Georgia Tech grad, industrial engineer, and I learned an incredible amount from her. Really, how to do the job well, and really as much as it is analytical, it's about people. Had another boss when I first joined what was then Carolina's healthcare system, a guy named Steve Wilhoit, who was on the partner track at one of the big 5 consulting firms at the time, and the group we were in had hired people with experience like mine and others consulting, and he really taught me a lot about being an executive, as well as interacting with executives, particularly at a large healthcare system like that, and learned a ton from him. And then former boss, hospital president named Spencer Lilly, who I still keep in contact with him. He's been able to pretty much semi-retire now, but was just a great mentor for me in the sense of always trying to do things right, thinking about not only the patient but staff, and really caring about people that you work with. But was able. He and I complemented each other very well, and the chief nursing officer, and he really let me sort of exercise what gifts I had against his, and that was a really great team to work with. I have very fond memories of working with him and Rose, the CNO at the time.
Yes, sir. I just got back from a leadership conference, and some of the speakers, a lot of them spoke about you got to find some mentors, some people with fruit on the trees where you want to be, and that's such an important part of your growth as an individual in all aspects of your life. With I think it was the village at Pelham at the time, or Pelham Medical Center, which it is now. When did you first start hearing about Pelham Medical Center and the village at Pelham at the time?
Yeah, you talk about divine intervention. Where I was before, I was at a point where I was really ready for an opportunity. I had looked around at other organizations, and really not looking at all, I got in my inbox a job announcement about something called the Village at Pelham, which frankly I had never heard of. I had heard of Spartanburg Regional, but had never heard of the Village at Pelham. And at first I thought, well, what is this? And then when I read it, I was like, well, this couldn't be more perfect in terms of what I would really like to do. I immediately almost responded to the recruitment firm and sent a resume and quickly sort of determined that might be a solid candidate. So, but at first I had no idea what it was until I learned, okay, it's Spartanburg Regional. I know where that is. What was also a great blessing is that hospital administrators have tended to move around a lot. I chose not to do that, which can slow your career growth down a little bit. But I chose not to do that. And my wife and I, with family, she grew up in Florida, I grew up in Alabama, had always said if we were going to move, we'd really like to move west instead of east, not further than Charlotte. And I was like, wow, this is right down the road, the direction we want to go. And you come down here and start meeting people, it's like, this is a great place.
Yeah, really. In 2012, I think you came on board. Just the growth you've seen since then has been incredible.
Yeah, pretty. One story I hope I never have enough dementia to forget is that early in my time, we're a 48-bed hospital. Early in my time, we only staffed one of the nursing floors routinely. They had 24 of those beds on the floors, and somewhere along in the first several weeks, we ended up having to open the fourth floor because we were just full. And I remember asking the question. I started in September, and I said, hey, when's the last time y'all had to do this? And they're like, Tony, we hadn't opened since March. And then, so, first time in 6 months, the place has to open additional floor. And then about every 2 weeks, we had to start staffing it. Staff were always great to either pick up extra shifts, or we leveraged our PRN staff. And then it became to the point where we got to open this floor. Now we'll staff the number of beds we need to, but we got to open this floor. So really, just in that first year alone, we were really hit with a lot of quick growth, and then the ER too. The ER. Every hospital is a little different, but the ER is a front door for a lot of organizations, and in our case, it's definitely the front door. And the ER volumes kept growing and growing, and people needed to be put in a bed. We had to expand.
With Pelham Medical Center, I know personally, just because my connection, all the incredible things y'all done and accomplished over the years. But what was it like when you first stepped on board? And what was the vision at the time of Village at Pelham, and then eventually towards the name change and what was going on then?
Yeah, so going back to when the place started, there was a great vision. Unfortunately, the economy kind of tanked it, but the idea was in this intersection of Westmoreland Road and Highway 14 was to have a village, and healthcare was a component of it. And on the campus was a medical office building, and then the hospital was built across the street where intended to be some retail opportunities. And another street corner, there might be some long-term care, residential, retirement kind of communities, and healthcare was going to be a centerpiece of that. The economy really kind of killed, particularly the real, what's the word I'm looking for?
The retail?
Retail, thank you. Senior moment that just killed the retail at the time, and then we owned that land but weren't really able to do anything with it. Along that time, in my early here, I learned getting to meet people in the community. Greer was very appreciative of having more than one hospital, wanted the hospital to be involved, but the further you start going outside of Greer, people really, where do you work? I've never heard of that place. Or is that Villages I hear on the TV, and it's like, no, we're not the friendliest hometown, and we're friendly, but that's in Florida, and people thought we were a nursing home. So we decided to rebrand, and we have a hospital advisory board, and they help navigate that for us. It was really, we changed the village was a wonderful concept, but the name change really came because we had an awareness issue.
Yeah, that makes a lot of sense. I remember when I would tell people where my dad worked, I would say the village at Pelham, and they'd be like, "What is that?" I'm like, "It's a hospital, man. It's like 15 minutes from here."
Yeah.
As a hospital grows, how do y'all decide what you specialize in? Because I think I know here y'all have had some incredible designations, and y'all do a lot of spine surgery and orthopedics. Like, how do y'all navigate what you specialize in?
Yeah, I mean, some of that is strategy. Some of it might be a little luck too. But I think generally, an acute care hospital, we kind of set out to be just a hospital that you would traditionally think of almost any hospital. They do medicine, take care of heart attack patients, strokes, as well as do some surgeries. We were fortunate to have a great spine surgeon who's since left us, who really wanted to try to build something, as well as another hip and knee surgeon who still is here, who again wanted to try to build something. So as they got busier and busier, we started doing more and more hip and knee, more and more spine, and they had to recruit partners. And so the orthopedic growth has really been born out of those physicians being experts at what they do and having a willing participant in the hospital to help grow around them. At the same time, we really made a conscious decision not to be a specialty hospital. If we had more places, more locations, we might have considered that. If you look at some of the facilities in Greenville, there's more hospitals with another healthcare system, and they have some luxury about what they might do in one hospital or another. This is the only SRHS outpost out here, and so we really wanted to cater to the community. And so what you have to do, healthcare is different than many other businesses. I'm certain BMW, for example, has its own approval, but they build cars, and if they grow too much or grow enough where they need to expand, they expand.
Yeah.
In our case, up until recently, not only did we have to make that decision, but we had to have the state's approval if we wanted to make expansions through something called Certificate of Need. And most of the things you do, beds, operating rooms, these are very expensive. And so you have to have a real strong business case to expand. And so, all that goes into building a hospital, if you will. But we've been very fortunate that we had some expert providers who got us off the ground, and they grew so much we needed to bring other surgeons on in those specialties. And as we grew, we expanded our primary care network, which created needs for other things, medical subspecialties like gastroenterology or other surgical disciplines that needed to support those providers. And so that's really how we've grown.
With y'all did get, I guess, approval for an expansion. What went into that expansion? And I could be off, it was like 2019 or so.
That's right. We expanded the ER. Now, as our bed utilization increased, I mentioned earlier before, we went to operating one floor to both floors. We expanded the ER and added what we call non-observation beds. Beds are licensed by the state, and essentially what that means is that the number of beds for which you're licensed, we're licensed for 48, that you can only have up to that many true inpatients in a bed at any one time. Observation is a different status for bedded patients. They're actually an outpatient, but they still get the same care as an inpatient. It frankly is a Medicare rule, largely built around trying to reduce overall costs. So those non-observation beds were not licensed beds, but we can still house patients who need a bed there. And so we operate 57 beds now. The long-term plan would be, if and when we grow, that those 9 beds would be taken over by the ER at some point. As we've grown, they're going to need more space, and it's ready-made when we are able to build more inpatient beds.
As you do research on y'all's operation here, and you start going down the list of these awards y'all have received over the years, you need a whole shelf, multiple shelves to put these on. I guess to me sometimes the most important awards would be like places to work,
Mm-hmm.
because that involves your coworkers, the people in the community that actually work here. What do you think is special about Pelham Medical Center and the community within the workplace?
Hands down, it truly is the people. Before I got here, there was an intent around trying to be different, oriented around the patient.
Mm-hmm.
And a big part of that is having a great workplace. And so that foundation was laid. And that was something we were doing in Charlotte at the hospital where I was before. And so you talk about a match made in heaven. It was evident. You start meeting people and it's like, wow, these are great people here. And you throw out ideas and you're not getting pushback as the new guy. What I found is that everybody really wanted to be part of something special.
Mm-hmm.
And so what we've tried to do is never lose that. We start culturally with our associates. There's no doubt that we're here to, and called to take care of patients, but if you don't have a great team of people, then quality care, great customer service will not follow. And so we've really tried to create a great workplace. It is nice. I definitely love the fact that we do get some awards. It's quite nice. I would say we don't really generally try to pursue the awards. The best places to work is one where we actually sort of pursued it, because the process you go through, there's some surveys involved and you get great feedback. We've always done annual associate engagement surveys, but the best places to work process is really a different set of data. It's enabled us to look at our demographic mix of people and try to get, isolate where we may have opportunities to improve the workplace. Generally speaking, the other awards, thankfully, have been bestowed on us. A lot of them are really just that. There have been some we've pursued, but it really boils down to the people we have here. We have great leaders and great associates.
With to piggyback off of that, and I think it was a perfect segue, is the people you have here have helped develop a culture where your patient experience has thrived. Talk to me how y'all's focus is on patient experience, and I mean, to throw another award, like you're in the top 5%, I think, in the country for patient experience.
Yeah, so that's something that all hospitals have to collect data for and report. It's a governmental requirement. It's something healthcare systems were doing anyway, but it is part of the way that we're evaluated and paid through Medicare. I think we've tried to hire the right people who want to be part of something special. And so, using your dad, I'm not blowing sunshine. Your dad ran restaurants. He knew how to take care of people and wanted to be part of an operation. In his case, separately, hey, look, if I don't treat people well, I'm not going to make money, and I got to feed my family. We have that very same mindset here, is that every customer interaction, whether it's an x-ray, a major surgery, somebody comes through the ER, is that those people need us, and we're here to provide the best experience that we can. And so really, I think our best strength is hiring the right people. We do put people through all across our system an extended interview process. We involve team members in helping hire the right people that are going to fit. And we've been very fortunate with hiring a lot of great people who then in turn deliver that great service and care to patients.
Yeah, the people make the difference. I mean, it reminds me again of the leadership conference I was just at. They just talked about the people that you hire, that you bring on board, really, make your company what it is. With the community, y'all, I think have always been involved in the community, but y'all make sure that's a big part of what y'all are trying to do. Can you talk about, that push towards the community and some of the things y'all are involved in?
Yeah, happy to. So there's really two primary reasons. One is we're a mission-driven organization, so we're a nonprofit healthcare enterprise. Part of our job is to take care of everybody regardless of their ability to pay. And so we have some sort of mission-driven things we do, whether they're screenings, learnings, that kind of thing, to try to put people in a position to lead a healthier life. And part of that is growth oriented. Like I mentioned when we started talking, that people in the area just didn't know much about us, and so we've really tried to invest in a lot of different organizations that will enable us to become hopefully trusted in the community. That facilitates us being looked to as a partner who people might leverage for their health care, or leverage something in the community that makes the community better. So we're heavily tied, with a number of chambers of commerce, but most of the things we try to invest in are what I'd call mission related. So we do a number of things with schools. We do some things with other nonprofits. One of those being Senior Action in Greenville, which is a senior-oriented organization, as the name would indicate, to try to help them live just very fruitful senior years. And your dad was on the board at one time and introduced me to that. But what we found was an organization that did a lot of great things, but they wanted some partnerships in some other areas. And so we were able to bring the clinically oriented needs that they had to the fore. We've had a long-standing diabetic education program. And what we've tried to do is get as many people involved as possible. Traditionally, the role outside the organization falls to the hospital CEO and maybe a few other people. But we've invested in an outreach team that does great work, again, connecting with schools, neighborhoods, universities, any organization, faith-based organizations that might have a real need and where we can provide either some expertise or assistance, we want to try to do that.
Yeah, and I think, I know too, some like the events that go on in the city, like the BMW Pro-Am even, and some of the sports teams, I know, y'all are heavily involved with that, with healthcare in general. I think it's always a hot topic, and people are trying to figure out what healthcare is doing and how's it changing. In your mind, where do you see healthcare changing and kind of where it's going?
Well, that's a great question. I will definitely say in the 30 plus years of doing this, there's definitely been an evolution. One thing that hadn't changed is the patient at the center and taking care of that person, whether they're incredibly sick or nervous about something or having something simple done, but still, nervous about it. Even people getting an x-ray might be nervous because it's like the doctor ordered this x-ray and I don't know why, or I know why he or she ordered it, but I don't know what they're going to see, kind of thing. That hadn't changed at all. I think what has changed, I think people's, as a society, have changed a little bit in terms of, demanding things you might demand from a regular retail enterprise. It's like, hey, why do I have to wait 2 weeks to go see a doctor? Why do I have to wait to get my results or what have you? And some of that has been very, very good. I mean, we've had to respond. Generational differences have different values. And so, whether it's virtual care, that kind of thing, people, I have a 27-year-old son and he's like, Dad, I don't want to go to the doctor. I just want to, well, I get it. Well, here's some options for you. But they just demand certain things that, I, as a 55-year-old man, look at it as that's how it's been. That's the way it's done. I would say long-term, the biggest evolution I can see is ultimately how healthcare gets paid. I mean, any business, whether it's a restaurant or you own a cleaning business or a hospital, how you offer services is going to be built around how you get paid. And so, we're not in the business of making hamburgers or building cars, but healthcare is a very complex business. There are many services that do make money based on the way we get paid. There are others that we do because they're needed services that you don't make money. In fact, you lose money. But, inpatient medical care, for example, is a great example. It's very costly. The payments primarily from Medicare and even from insurance companies don't stack up. And so, there's a concept called population health, which is basically oriented around, instead of paying a hospital or a doctor for every episode they do, we want you to take care of a population of people and do it as efficiently as you can. And so there's something called a per member per month kind of payment, that instead of you getting paid for the surgery that you do, you might get paid X amount per person under your care per month to take care of them and do the best you can to try to drive costs down and quality up. So, assuming that happens in my career lifetime, that's probably going to be the most radical. But in terms of how you take care of people and how you build trust, that I don't think that's going to change.
Yeah, I know that how you're going to get paid is always a big topic. It seems like it is ever changing, and there's all more options coming available. A big thing, and it's not just in healthcare, is artificial intelligence, AI. I've listened to some people talk about AI and incorporate it into healthcare. Have y'all looked into it much, and do you see that playing a role?
We have, and I definitely think it'll play a role. Thankfully, I think our organization, like most that we've spoken with and benchmarked with, I don't want to say a cautious approach, but a slow moving approach in that I think there's a belief, you see something work with a game or something like that artificial intelligence, that's going to make healthcare better. Healthcare is still a human judgment kind of business, and a robot isn't going to be able to take better care of somebody than a human, certainly from a compassion perspective. On the flip side, there are, I think, some real applications that are evident that our organization and many others have either evaluated or taken advantage of or will. So one example is, with enough image review, can an AI algorithm read an X-ray? Yes.
Yeah.
And in fact, they may find some things that a doctor might not find. On the flip side, not going to have the judgment that a physician has. So I think what we'll probably see over the next 10 years or more is mostly what I'll call consultative components, is that, hey, I'm taking care of all these people upstairs and we've got 50 patients in the house. This particular patient, was sick. An AI algorithm might be able to identify based on some other things, this person might be likely to get sepsis and get even sicker at the hospital, or here's some things you might want to consider with this patient based on all the data we've accumulated and the condition that he or she is here for, and the doctor can look at that and say, that's actually pretty reasonable. Don't know that missing it would have caused harm, but that's really reasonable. Let's take a look at this. I think that's where the first big step is going to be. I don't think it's going to take away the need for physicians or nurses or other staff members anytime soon. And in fact, I doubt it ever will. I'd like to think it never would.
Yeah, I don't think it will ever do that. I do think it could provide value, like you said, reading reports. If you could just analyze reports or somebody's healthcare history and just be able to provide an assistance.
That's another great example. That is one where I would say if there's the most use across the industry now, that is certainly one what they call administrative tasks. Physicians, even with an electronic medical record, still have to document. Sometimes that documentation is free text. With voice recognition technology now, there could be ways to not only collect that, but make that the note, and have a physician really just review that note instead of having to do all the documentation themselves. There's billing related things and other administrative type tasks that could make people more efficient. Healthcare has been a very people dominated business, and like any business, you have to look for ways to manage to the revenue that you have coming in. And so if there are ways to truly make people more productive without adding another body, we definitely would want to do that, and those administrative tasks is one area where that's really occurring now.
Yeah, drive efficiency.
Absolutely.
With another part of y'all's incredible operation out here is the Gibbs Cancer Center. State-of-the-art facility, incredible, it's beautiful. How did that come about?
Yeah, so going back a little bit, there were some very wise physicians and leaders in the community and at the hospital ages ago to start a really world-class cancer center in Spartanburg. There were a couple of doctors who had local boys who came back and wanted to have that level of care that you can get in a bigger city delivered in Spartanburg, South Carolina. And so first it started with a vision, like most things, ultimately expanded into partnering with really arguably the world's most renowned cancer center, MD Anderson in Houston. We became an affiliate, and they helped long before I got here. Those folks really understand what it takes to be a world-class cancer center, and we've since grown out of that relationship, frankly. With the growth happening in the upstate, the decision was made to plant a facility here, and if you look at the entire upstate, really this campus is right in the middle of that. And the premise was, look, we need to have places where growth is occurring so people don't have to travel far, and to be able to give great care for people close to home. What has really, I think, separated that, and I don't say this just because I'm employed by Spartanburg Regional Healthcare System, but we're really very fortunate in the upstate to have a resource like the Gibbs Cancer Center. You would not typically find the depth of resources we have. No disrespect to any other healthcare system around, that other than in a big city.
Mm-hmm.
And so, we've invested a lot. Part of the investment here is to bring care closer to home for people. We have both radiation and infusion. Something that our team has always done is what we call multidisciplinary conferences. When someone presents with cancer, a team of surgeons, medical doctors, radiologists, other non-physician clinicians get together and talk about that case and ultimately try to identify what does the evidence say is the best course of treatment for this person. Mm-hmm. And that multidisciplinary conference approach is at the core of that and what's done. But we built the buildings here first with the radiation building because people needed care and we didn't want to have them drive to Spartanburg for every treatment. And in many cases, radiation requires a lot of different treatments. So you got somebody, I got to go 6 weeks, I got to drive 30 miles up the road or wherever they may live. So that was the first step. And then building the tower that we did, which is all outpatient, was again intended to give people a place closer to home that they could trust for either their care, a second opinion, or lifetime management.
Yeah. Are they able, on the services front, are they able to get like their full scope of services at the Gibbs Cancer Center?
Yes. Some things we don't do on this campus yet. We have some physician disciplines that are just in short supply that we might not have on this campus yet. But by and large, yes. There are some things that you might naturally be referred to a specialized place, depending on what kind of cancer you may have. But by and large, chemotherapy, other infusions, radiation therapy, and surgical options are all available in our system. Mm-hmm. Again, if you've got something that is, there really is one specialist in the world or the country who can do that, whether that's at MUSC or at a Duke or somewhere in Charlotte or Atlanta, we definitely will refer people there when we're not capable. Yeah. And there are plenty of those. There are certain things that just a very small group of people are experts at.
It did remind me of kind of the Myers Center in a way, mm-hmm. where you have the approach of like trying to be able to provide most or all services under one roof to mm-hmm. make it easier on the patient and the mm-hmm. family, which Myers Center is a different operation, but mm-hmm. I think that approach is really cool. I was reading and it said within the Carolinas, Pelham Medical Center is the only Orthopedic Center of Excellence. What does that mean?
Yeah, so that's one we're building off of the earlier questions you had about orthopedics. What we and our physicians primarily felt like is that this is really about quality care, mm-hmm. and we want to validate that our care is as world-class as it can be. I'll call it world-class. And so one of the things we pursued was an outside designation. And every hospital in the country is evaluated by either a company called the Joint Commission or D&B, which is what we use. It's pretty common for those organizations to also have disease-specific or discipline-specific certifications that are built around, well, this is proven to be the best quality that drives the best outcomes. Mm-hmm. And so we pursued this outside Center of Excellence designation to help us validate that our spine care, that our foot and ankle care, that our hip and knee care was really the best it could be. And it really wasn't about doing as many surgeries as we could. It was about taking these people with hip and knee, spine, foot and ankle problems and taking the best care of them. And that's what it's been has enabled us to do. Some of the things we were already doing, we, for example, have always had what we call spine camp or joint camp, where people come in ahead of their surgery, where we try to teach them prior to their surgery how to get prepared for the surgery and how they're going to mm-hmm. recover. But in terms of the clinical aspects of care, having the physicians and our staff and other clinicians at the table has really, I think, elevated how we take care of people, the things we measure, to validate that A, someone needs a surgery, but B, when they get it, they're going to recover in the best way possible so that they can go back to living mm-hmm. their life. And so it was really about quality and pursuing that, and it helps to have an outside validation for that.
Yeah, I thought that was really cool to see. With you're obviously a key member to this operation, organization. Like you said, it's the people that make it run. Mm-hmm. With you outside of your professional life, what are things you like to do?
I have a few joys. My family is certainly one of them. I have three boys, and
How was that growing up?
well, it was never a dull moment, as you might imagine. They're about 3 years stair-stepped apart from 1 to 2 and 2 to 3, and they really have been a great blessing. But there have been trials, but really, as they've grown, I have really enjoyed just growing to being a father even more, and so. My first choice in life is to generally try to spend time with my wife and those 3 boys. We do have some very close friends, that we spend time with. We do have a piece of lake property that has really become, our little slice of heaven. That just to get away, get on the water. It's very peaceful. We've got neighbors, but they're not like right up on you.
Yeah.
And doing that. Outside of that, I mean, going to Auburn. Love college football in general, certainly all things Auburn. Love college sports in general. But my parents did a great job of what I'll call Americanizing themselves. When they got here, mom and dad had season tickets to everything, and they loved sports in general, and they viewed that was a way to connect with people.
Definitely.
And so, I don't have lots and lots of hobbies. As I've aged, I definitely value travel more. My wife and I do probably not enough of it, but we do a little bit of it, and so those are the things that keep me grounded.
The the Iron Bowl this past year probably was hard.
It was heartbreaking. I wish you hadn't brought it up, frankly, but what I was proud of is the way that we played, and I don't know if we played that game 10 times, what the outcome might have been, but on that day, we really played well enough to win, and I think if that last play that Alabama scored on, had been run 1,000 times, I think we would have stopped 999 of them. But it was, believe me, my son and I were on pins and needles. Our hearts were racing, and then it just went silent after that. But it was an incredible game.
It was. With you mentioned lakes, and that's another great part about the upstate. We have some beautiful lakes. And have you been back to Greece?
Growing up, I went pretty frequently. My mom primarily, my dad was the worker in the house, and my mom and I would go for summers, a month and a half at a time, to spend time with family. So my mom had a sister that still lived there, and my grandmothers were there, and so went quite often. The last time I think I went was 16 or 17, and then it took another 25 years to get there. So in my 40s, my parents were still alive. We wanted to make a trip, took our children, and really had a trip of a lifetime. It was wonderful to be with my parents, but the boys got to experience another place, another culture. I think it more than anything gave them a great perspective of how good America is. Sure. But we got a chance to go to my parents' hometown, which is the second largest city in Greece, spend time in Athens and on some of the island where my dad was born, and hadn't been back since. That was, 15 years ago or so. So not frequent enough, but I still do have some family there. My brother actually went a few months ago, and
cool.
My aunt, the oldest of the 3 from my mom's side, is still alive, and she's the last one.
Very cool. It's on my list for me and my wife for sure.
Definitely try to do it.
With the Greenville community, what do you think is special about the Greenville community and just the growth of the upstate in general? Yeah,
I found, it's an easy place to sort of get connected. There's not, sort of like some places, if you're not one of the heads of the 5 families, you might not get in. I found Greenville to be incredibly welcoming. The other thing that I really like is how the community has embraced healthcare. The people here, the Chambers of Commerce, others have viewed the hospitals as very meaningful enterprises and value perspective, involvement from that. And the people, I think, have hopefully a trust level with our healthcare systems around here. If you go to a bigger city, healthcare is often another big enterprise, like many other big enterprises, and the engagement might not be as much. I found the engagement in the community wonderful. It's really been a great way to represent the hospital, but do a lot of things in the community that I personally enjoy doing that add value. Outside of that, living here is really second to none. I mean, other than 8 miles of stretch on the interstate, we have no traffic problems. People are nice. You have access to mountains, lakes. The beach is not far. It's just a wonderful place to live, you know, and so my hope is that particularly Greenville, but Spartanburg too, don't lose the character that they've had as a really nice city. But when you grow and grow and grow, you know, naturally you lose some of that. That my hope is not to lose some of that. Part of our motivation for the lake is knowing that that's going to come.
Yeah.
Is that our little piece away from everything is there.
Yeah, your little sliver of heaven out
Yeah,
there.
that's right.
Tony, it's been an honor having you on. Like I said, I felt honored in a way to come over here and be able to talk with you. And you spent so many years working with my dad, and getting to know you now more is, I think you're, you know, a lot of what you are embodies what Pelham Medical Center is trying to be, and you're a key part of that. Thank you for coming on. It's been a pleasure having you on, and I'm excited to do more of these with you and the organization.
Well, me too. I appreciate you doing that, and your words are very kind. And people like your dad are really what make this place very, very special. And you should be proud of the legacy that he's left from a workplace perspective. You know, Sam is a highly regarded man in Greenville, and again, the things that he did here really helped create what is special about this place. So we're honored to be part of your great program.
Thank you so much.
Thank you.